business has been opened up, with mainly focusing on the senior care, child care, child minding, and physiotherapy. We've been exposed really to the market mainly in Dubai, where we were to cover actually all sort of child care, starting from postnatal care, neonatal care, maternity care, postpartum, during maternity cares as well, senior care, and physiotherapy.
I'm Sian Collier-Jones. I'm the case manager here. I come from a nursing background. Basically, our nurses go out to a range of clients. The senior side, it's the Arab culture to look after the elderly, and there's a distinct lack of senior care in the area, and certainly no palliative care or hospices. So all of it's done at home, which is a big responsibility for families. It also can lead to difficulties if they're not receiving professional care. All of our nurses hold a Bachelor of Science in nursing, so are highly experienced and trained. Simple things like moving patients, making sure they don't get bed sores or get ill, getting fed properly, the right nutrition for their needs and their illnesses. Basically, for senior care, as well as the need, it's more dignified often for the elderly. They're a lot more comfortable being treated in their own home. They get quite confused, disorientated if they're put in new surroundings with strangers, so it's very familiar for them. The childcare side of things, obviously a lot of the expat community here, they move, then have families. They don't have the support network that they would have at home. So when they find themselves starting a family, having children, they can feel quite isolated. So our nurses, a lot of them have midwifery training as well as neonatal and newborn training. So they're able to provide expert advice, simple things, how often should a baby feed, how do we get them in routine, when do I start weaning, what do I wean them on, all the things that a lot of people at home would ask their parents, ask their mum. So it's having that support network, having that expertise to deal with newborns. Also then when the babies get a bit older, when they become school age perhaps, they don't have anyone for childcare if they want to go out for the evening, want to go away for the weekend. So we offer other nurses then that can go in, and the families have the reassurance that obviously the nurses are trained in emergency, first aid, CPR, life support. Should anything happen, there's a fully qualified nurse there, not just a babysitter, basically. It's the support, but it's also the expertise. Having a professional, that when you ask for advice, you're getting the most up-to-date research, evidence-based advice. It's not hearsay, it's not old wives' tale. It's professional, it's correct, and you know that you're doing the best for your child. The top 10 countries in the world with the highest diabetes rating are actually all in the Middle East, and the UAE is one of the top 6. So it's a massive area here. There's a whole range of things. We can go in, help with the insulin injections, help monitor the blood sugar levels. It's not just the blood sugar levels, there's a whole range of things, educating the clients, educating their family. The things that come with diabetes, such as diabetic retinopathy, which is problems with the eyes, making sure they recognise those symptoms. Foot care, obviously because of vascular problems, making sure they're aware of that, which a lot aren't, which can lead to difficulties. That they can manage, they recognise the signs if they are becoming unwell, if they're getting hypoglycemic, they know how to treat it. Our nurses would be able to advise them, as well as obviously provide all the acute clinical care side of things, and to educate them to manage it themselves. Obviously everyone's an individual, and we do respect that, and every client is an individual client. They're not just a client with an illness, they are an individual that we treat all aspects which best suits them. And obviously we fit in much better around their busy schedules, their lives. We go into their home, they don't have to worry about going to the doctors, going to the clinic. We go to them and make our service suit their needs. Sure, we advertise in a range of things. Our childcare, for example, is even available in the entertainer book, which is quite popular. We're on the web, you can phone us, fax us, Doctor?
Yes, I mean, we have been involved in lots of really marketing activities in order to be exposed to the community, and minding that, for the last 3 years since we've been operating really in a good way, actually, word of mouth was one of the highest, source that, clients get to know about us. So simply they just give us a call, they put the inquiry about the need, the length of the service, and for what kind of nursing services needed. Is it for a clinical, non-clinical? And then from that point, we studied the case provisionally, after which we evaluate it, and then we pass it on to our case manager in order to allocate the suitable nurse to provide the best possible service.